topic I want to talk about today was urinary incontinence with exercise. And the reason I wanted to talk about this one was it was actually one of the first things I believe I heard when I got into pelvic health physical therapy. There was this viral video of somebody, someone being interviewed for some type of like high intensity workout. And the person has said that, oh yeah, it's normal to pee when you lift a really heavy weight. So it's not. That's not normal. That's actually failure of the muscle system supporting the organs above it. Now, when we talk about urinary leakage, it's everything from little drops when walking, little drops when you have urinary urge, to filling a full pad with urine when exercising. And sometimes people aren't aware that they're leaking. It's not until after that they realize, oh, actually, this really wasn't sweat. This is urine leakage, and I don't really know why it happened. What's the difference? What caused it? So I want to get into a little bit of that. And I brought my pelvis model today just to introduce everybody to pelvic anatomy a little bit. Okay, if all the magnets don't fall off, that would be great. Okay.
Awesome.
So,
I'm glad you have this.
Yeah, so this is a female pelvis, and the lighting is good so we can see the bones. So when we talk about the pelvis is actually the inside circle here between the two hip bones. So if y'all can put your hands on your hips right now, you can kind of find the top of the crest. Your hands come all the way down your waist. You're really going to hit the top of this crest, the iliac crest of the hip bone on one side. The bones come together in the middle at the symphysis. So that allows movement. This is really important in females because this does widen in order to give labor, just widen when the baby gets bigger and bigger throughout pregnancy. So in this pelvis, in this pelvic outlet, we have muscles. So you can see that there are no hip muscles here in the back. I'm just gonna take this off. There are no glute muscles. This is the back of a pelvis with the sacrum, with the spine, with the little tailbone. Where is it? Little tailbone down there. So we're really thinking about the deepest layer of muscles. So what are these muscles? What do they do? So I'm going to flip 90 degrees just to orient y'all. So these muscles go from the front of the pelvis at the bone, at the pubic bone, all the way to the back to the tailbone. So you can see they form a diamond. The muscles in the front, these are the most superficial muscles. Superficial means closest to the surface. So these muscles have sphincteric function. That's really important. The other sphincter that people are very familiar with is your mouth, your lips, sphincter, to be able to make a circle. So very similar. The muscles here are circular. They pinch in to close around the orifices. So they close around the vagina, they close around the urethra, and they close around the rectum in the back. You can see right here, okay? So if I were to take that, if I can take it off, let's see. Wow, magnets. All right. So you can see there's another layer underneath. So the layer underneath is primarily responsible for support. This layer is called levator ani. So levator, like an elevator, literally to lift the anus. What is really important about all these muscles acting together, because no one of them really acts in isolation. They all act as a unit, or they get uncoordinated as a unit, is that they support the muscles in the outlet. So again, I'm going to flip. We're just orienting again here. So we have the bladder in the front, the little bladder. This is a uterus, and way in the back, kind of got jammed in there, is the rectum. Okay, so from front to back, you'll see 1, 2, 3. So we're going from the front to the back of the body. So that's not a lot of space, right, between the front and the back. But we have these three very important organs that are held up by the floor underneath. So we think about the pelvic floor like a trampoline. It should be able to move. It should be able to go down. It should be able to come up. And then why it does that is to support the organs above and to support your core. It's not a rigid structure. Oftentimes we call it the floor of the core. I always say it's kind of like a dance or a yoga floor, where if you have ever been on one of those, it's a little bit springy, so that when you're jumping, you're pirouetting, you have that like really nice like give when you hit back down. It's adaptable. That's the biggest takeaway. And I say that now because a big part of what I do is re-education about these muscles and about Kegels, which I'll get into a little bit more later. But so we know now we have muscles in the front that are sphincteric, they close around the opening. We have muscles in the back that lift the anus. They work together. They lift up, they drop down, and then they elongate, they drop down even further. So in the metaphor of, I always use my hand because a really good idea of how the hand works. So pelvic floor closes and tightens, relaxes and opens, and then it stretches, okay? Why we don't really feel that unless we're really paying attention is that there's no joint here. So all the other muscles have really good sense of where we are because something called joint sense. We can tell where we are in space by how the bones move. Poor pelvic floor doesn't have a joint. So unless we're really paying attention to what's going on from the pubic bone to the coccyx at this deepest level of our seat, we're not really gonna know what exactly is going on. So next question, how do you know what's going on? Pelvic floor moves in coordination with your breathing. So has no joint, but it moves regularly. It's moving right now when you're breathing, you're inhaling and you're exhaling. And the reason is it has to maintain that support of the organs. It's never gonna just let go and fully relax. It's never gonna contract fully and just stay tight and hold all the time. It needs to be able to do both while you're breathing. So if you're in a seat right now, maybe just notice the area between your sit bones. So sit bones are the bones of your butt. If you're sitting, they're kind of the sharpest point. Take a couple breaths. Do you notice what's going on there? When you inhale, the pelvic floor should lengthen. When you exhale, it should lift back up. It's very small. It's not like a big bellows. It's not like a parachute where you're going to feel this super grand movement. It is a very small excursion. So I always say, like an elevator moves from the lobby to the cellar. When you get on that elevator, you get there really quick. You're like, oh, I'm here now. Pelvic floor too. Oh, you're already descended on your breath, on your inhale. Oh, already lifted on your exhale. So it's very small. It's a mindfulness practice. It's a body awareness practice to be able to sense where those muscles are.